All right. Good evening, ladies and gentlemen, and for those who are also going to be joining us at a later time via our peer support groups, via YouTube channel. My name is Dr. Christian Vidicchio. I'm the CEO of Heart Support Australia, and with me tonight we have an amazing guest speaker, a colleague of mine from the University of Sydney, Dr. Dion Candelaria, who will be giving us a presentation tonight on consumer engagement in heart research. So welcome, Dion, and thank you for coming along. Just as a brief introduction, I think I'll give an introduction around what Dion is, what his background, and some of his research insights, so all you can understand just how much of an up-and-comer he is in this space. So Dion is an early career researcher at the University of Sydney. He's a registered nurse specializing in various areas of cardiac nursing, and his research focuses on supporting patients to reduce their risk of further cardiovascular events through promoting secondary prevention behaviours and cardiac rehabilitation. His doctoral work, completed this year, investigated the influence of cardiac rehab service delivery characteristics on patient-focused outcomes. And Dr. Candelaria is currently a research fellow in the MRFF grant-funded cluster randomized control study that aims to improve the delivery of cardiac rehab through a collaborative quality improvement approach. He's the current Vice President and President-elect of the Australian Cardiovascular Health and Rehab Association in New South Wales and ACT, and he's also an Executive Board member of the Cardiovascular Nursing Council of the Cardiac Society of Australia and New Zealand. So, Dion, thank you for joining us tonight. It's a pleasure to have you along here. Heart Support Australia, as you know, is a peak body providing support to Australians affected by heart disease. And having you along to provide, or in one of our bi-monthly talks on Heart Support Connect is very important to us, and we appreciate that. And I guess just for some information for those listeners out there, or those who are watching us down the track, please, if you want to stay up to date with any information about Heart Support Australia, our new peer support groups that are opening up monthly at the moment. We now have 23 locations across the country, including new groups in South Australia and Tasmania for the very first time. Please feel free to go onto our websites and all our social media pages on Facebook, Twitter, or even LinkedIn. So on that note, I'll just leave it from there. I'll hand it all over now to Dion to take control and enjoy the presentation we have.
Thank you. So
let me just go here. So I'll hand you over. There you go. All yours, Dion.
Oh, good. Okay, so just making sure you can see the full screen of the presentation.
Yep, I've got it here.
Cool. All right. So thank you very much, Christian, for that introduction and for inviting me for today's talk about consumer engagement and heart research. Consumer engagement is what is an aspect of my research that I'm really proud of, and that we're really championing the engagement of our consumers in everything that we do. So before I start, I'd like to acknowledge the traditional custodians of the many lands in which we meet. I pay my respects to their elders, past and present, and extend that respect to Aboriginal and Torres Strait Islander peoples here present today. So just a brief overview of what we'll be talking about, or what I'll be talking about. So this is not going to be a masterclass, if you like, of consumer engagement, but rather a bit of an introduction on what consumer engagement is in research, why consumers should get involved in research, and the different levels of consumer engagement. And then also a part of the presentation is a bit of sharing from my own experience in engaging consumers in my own research. So patients or consumers as partners in research, this is one of the most popular quote, I would say, nothing about me without me. This quote moves away from patients as subjects of research and puts them at the center of research activities. So rather than the patients, rather than research being conducted to or about or for patients, the concept of consumer engagement brings the patients to the center, and research is being carried out with or by the public or by the patients. There's a bit of terminology differences around the world in terms of consumer engagement. In Australia, we call it consumer and community engagement. In the UK, patient and public involvement is what they call it. In the US, Canada, they call it patient and public engagement. So they're synonymous. But as you can see, I suppose in Australia, the way we phrase it as consumers, we highlight the patients being end users of research. But also later on, I'll talk about what consumers are. But also in terms of the nuance of engagement, I think calling it engagement is more active than involvement. You can involve someone, but they may not be engaged. So there's different terminology and nuances in these terms. And also I'd like to highlight that when we say consumers, we don't mean patients being recruited into a study. So patients being recruited into a study are participants, but they can also be consumers. But when we say consumer engagement in research, we talk about what the consumer's role is in the research process rather than being in it. So that's like one distinction that I want to make early on. And throughout this talk, I'll probably swap from calling consumers patients at the same time. So patients and consumers, I'll be using these two terms interchangeably throughout. So it doesn't get repetitive, or so you don't get confused. So what are consumers? So consumers are people with lived experience of a health issue. So lived experiences are rich sources of information, and they don't just depict the experience itself, but also includes the knowledge gained from the experiences and the choices that patients made. Consumer engagement in research is ensuring that patients' voice is heard, particularly those with first-hand experience of a specific health issue. So consumers are people who might have received or used healthcare services. These may be patients, but not limited to patients. They could be their friends, families, carers, or more broadly, the general public. Consumers can also be people who represent views and interests of a consumer organization. So a consumer organization is a group of consumers with a set agenda. They can also represent the views and interests of a community or a wider constituency. So as you can see, it's not just the patient itself, the patient themselves, but the people around the patient and even the community in which the patient is situated. This is an important point. Representation by carers or consumer advocates is especially important for any consumer group that might have trouble getting their voices heard in their care. For instance, people with dementia or people who are suffering from mental health issues. So all the more you need consumers involved or consumer advocates involved in these type of research. So now that we know what consumers are, what is consumer engagement then? So consumer engagement is about involving consumers in decision-making around the research. So be it decisions at an individual level, so around people's own health, treatment, and illness management, and that's what we call consumer-centered care, or more broadly at the health service level, around policy development, service design, delivery, and evaluation. So consumer engagement is important at a health service level, because quite frankly, policies around service design ultimately impact or ultimately has an effect on the patient consumer themselves. So we're not only dealing with at an individual level, but also at the health service level. So why should consumers be involved in research? And this is probably not an exhaustive list, but these are the main points that I want to share with you in terms of the importance of consumers being involved in research. One is identifying research priorities. So identifying research priorities, consumers are crucial at this stage, because you want the research priorities to matter to people living with a health condition. You want to establish the significance of the research in making a difference in patients' lives, or in answering a question that is important to patients. And that's why the next point is research questions. Consumers help shape and clarify research questions so that they reflect the needs and concerns of patients experiencing a health condition, or patients who have experienced a health condition. So identifying research priorities and clarifying research questions actually go hand in hand. The next one is methods. Consumers help ensure that methods proposed for the study are appropriate, acceptable, and sensitive to the very real context in which patient and informal caregivers live in. And particularly in methods, we talk about patient burden. If we are designing a study, the methods that you are proposing shouldn't be too burdensome for patients. Otherwise, you're going to be adding to that burden, but also patients are going to be losing interest if it is too onerous as well. So making sure that the methods are not just appropriate, but also acceptable and sensitive to the patient context, especially patient journey in hospital. The next one is outcomes. Consumers help research outcomes or identify outcomes that have true meaning to their lives. So again, this resonates with the significance of the research. You want your outcomes to be meaningful for patients, because it might be meaningful for the researchers, but if it's not meaningful for the patients, then you're measuring the wrong things, or you're trying to make a difference in the wrong aspects. The next one is a bit more practical, language and content. So language and content with research, patient information, and consent, making sure that the language used, especially in patient information and in consent forms, are understandable at a lay level or at a simple level. And later on, I'll give you examples of how the consumers I personally worked with actually reviewed the patient information sheet and encircled questions that or abbreviations even, and terms that they don't understand. And I think that's very helpful in ensuring that the patient information sheet conveys information at a language that patients, or at least the majority of patients, do understand. They can also help with increasing participation in the study by making sure that the research is appropriate and acceptable to potential participants. In my case, and I'll talk about it more later on, but we had a recruitment strategy, and this recruitment strategy was kind of co-designed by the consumers that I was working with, to make sure that I get the most interest for the participants in my study. Aside from research priorities and research questions, there's also a potential for exploring new areas of research, or for new areas of research to be discovered. So this is done by conversation with consumer groups, because sometimes researchers come in with an idea, but then that idea is explored further by consumers, and they say, how about this? Why don't you look at this? And that broadens the perspective, I think. And it opens up potential to explore other areas of research that actually do matter to patients. In terms of research finding, consumers are very important in interpreting research findings from the perspective of the people with lived experience. This is very important, particularly for qualitative research, because sometimes, and most of the time, as researchers, we do have biases that we have to acknowledge and be conscious of. If it is a research with numbers or quantitative research that aims to quantify things, then that's more black and white in terms of what the numbers say. But with qualitative research, sometimes as researchers, we want to look for what we want to find, and that's because of the background knowledge and probably the biases that we have. But in interpreting research findings, particularly the qualitative one, patients have a different lens because they see it from the perspective of someone who's gone through the journey as a patient, and they could say, look, this is, I think, what this patient means when they said such and such quote. And as researchers, we won't be able to decipher that because we don't have that insight of being a patient. So that's I think, one of the valuable parts of including a consumer in terms of analyzing and interpreting research findings. And lastly, to help ensure that the research reflects concerns, interests, and values of the public, and to make sure that money and resources are used efficiently. Because again, if you're not asking questions that are patient sensitive or relevant to the patients, then it might be not a very good use of money and resources. So knowing that, we now move to the levels of consumer engagement. As you can see, there's a pyramid with different levels of consumer engagement, and it is not expected that that we go for the top level of consumer engagement. Obviously, it's a scale, it's a continuum, and sometimes you go back and forth the different levels depending on the different stage of the research. So this is from the National Health and Medical Research Council in Australia, but I think it was adapted from a cancer organization that I'm not quite sure of. But anyway, let's start with informing. Okay, so when patients are informed, they are provided information. So this is the most basic level of consumer involvement. Researchers make information about the research available to consumers. So consumers get information, consumers raise, researchers raise awareness, and consumers seek feedback from the researchers. Okay, so informing, consumers are being informed. This is what the results are of this research, and that increases the awareness of the consumers. So that's a very basic one. Now, you want to move from informing to consulting. So consulting is probably the most common or most widely used level of consumer engagement. This is where consumers are sought information, or researchers seek information from consumers, and researchers seek feedback from consumers. But the problem with consulting is, just like if you're asking a friend for advice, you may or may not necessarily take the advice on board. So you may have consumer advisors and ask them what they think, but ultimately the research team then decides what to take on board and what not to take on board. So that is a tricky place to be in, because of the potential for tokenism. You may want to just ask for information. This is what they say, and you go, right, we've asked the consumers, tick, we move on to the next, without actually taking the advice on board. So that's that's consulting. Now, the next level's involving. So when you involve patients in your research project, or consumers in your research project, you share responsibility in decision making. So it becomes a discussion. So at this point, patients' voice is heard and is part of the decision-making process. And I think this is healthier than consultation alone. Being involved and being part of the decision-making regarding the project. So the next step is partnership. So partnership is where there's collaboration between researchers and consumers. And this is the point where researchers and consumers are equal partners. And they may co-develop something. This is where co-production happens. They may co-design interventions. Interventions where both the researchers and the consumers talk about the direction of a research, or the components of a research intervention, for an example. So at this point, researchers and consumers work equally, and there's administrators, researchers, and policymakers all together. Now, the last and the highest level of consumer engagement is when consumers actually lead the research agenda themselves. So the consumers set priorities, lead major activities, or even commission researchers to conduct research on their behalf. Now, consumer-led research activities are oftentimes they're initiated, or they're conducted by consumer groups rather than individuals. Whereas all the other levels, you could have consumer as individuals rather than as a consumer organization. That's just one thing I would like to emphasize. Now, at which part of research do consumers play a role in? Actually, the ideal is for consumers to be involved, or to be engaged at all levels of research, from identifying and prioritizing of the research question or the research problem, to commissioning. So commissioning is when you apply for a grant, for instance, to make sure that consumers are part of that process as well, of reviewing the grant and building the rationale or the case for the study, up to the designing and managing of the project, designing, and that's what we talked about earlier, about making sure that the methods are sound, the methods are acceptable, it's not overly burdensome, making sure the questionnaires are easily understood, the letters are big, for instance, if it's a paper and pen, these kind of considerations. Undertaking is the actual conduct of research. Disseminating disseminating the research findings. So this is where the assisting with the analysis, for instance, or the interpretation of the research findings is very important. In my case, I worked with a consumer that was valuable from the conception of my research up to the end, that resulted to a co-authorship in one of my papers. So disseminating is also publishing of the results. So as part of as a recognition or acknowledgement of his contribution in my research, when we published the paper, he actually was qualified to be a co-author in there. So that was really good, and I'm really happy about that. Implementing is consumers being involved in looking at the health service side of things and how the research can be implemented into practice, and then evaluating impact and making sure that the research has achieved what it set out to achieve, and what other impacts it has gained. So having a consumer lens across all of these research projects, or in the different activities within the research cycle, actually makes the research more valuable and more significant, because it brings it back to the patient journey, the patient perspective. Now, before I give an idea of how I involved, or how I engaged, the consumers in my own research, I'll give you a bit of background of my research area just for context. So my thesis was around patient-focused outcomes in cardiac rehabilitation and the influence of service delivery characteristics. So it's across 4 sites within a local health district. And I started in 2019, 2022. Yeah, I started in 2019. So we were in the middle of data collection when COVID hit. So we had like emergency meetings with, of course, the whole research team plus consumer representatives, and we had to pivot the study into a different direction. And because we're working in cardiac rehabilitation, which is naturally an in-person service, at the time, all of the programs shifted to remote delivery, which now in hindsight opened up opportunities for us to compare outcomes for those that we already have, collected those data that we already have while it was in person, and now the second half was delivering in a remote delivery, but obviously it wasn't controlled in any way, just as it happened. So I remember even during that critical decision-making period, we had to change the questionnaires that we were asking. The initial assessment has changed, and the consumers were valuable in making sure that the ones that really matter were retained in the design, and those that are, I suppose, less valuable from a patient perspective were kind of let go, and we in the change of the direction. So that's the context. And my current research is improving the quality of cardiac rehab using a collaborative approach. So that's moving forward. Now, so my experience was, so the consumers that I've worked with were former cardiac rehab participants. Okay, we call them cardiac rehab graduates. So they've had a heart event, they've gone through the program, and now they have the privilege of hindsight in terms of what they've experienced. So they've learned, and they can now reflect on, oh, during my time, it was, this is what happened. And now looking back, I would have done it differently, or I wonder if X, Y, and Z. So now the tasks or the activities that the consumers were involved in my research were, one, they've attended preliminary meetings regarding research design. Okay. And when I say research design, I think it was even before the design, it was the conception of the research question. So at the time, the research question was, does cardiac rehab make a difference to people's lives? So then we looked at health-related quality of life in patients undergoing cardiac rehab. And that was in the context of the advances in technology and medical interventions. Now there's stents that are in certain places a day stay, and they have, quicker recovery. So we were trying to establish the value of cardiac rehab. Selecting and prioritizing outcome measures. So our measures were health-related quality of life, their self-efficacy to exercise, how motivated they are to exercise and how accomplished they feel after they've exercised, for instance. I think that's very important for them. We also planned participant recruitment, especially during the COVID pivot. So when we had to change tack because of COVID, we asked the consumers, what if we call them via phone rather than in person? Is that okay? Would you be okay if someone rang you and asked the questions over the phone, for instance? And they said, right, that's okay. Some people have video video capability, video conferencing capability, just like you do. So they said that's even better because you can see the person and you can have an engagement. So another aspect that they were very helpful was reviewing information sheets and consent forms. I've talked about this. We also developed interview questions with the consumers, and even with the way the interview questions were phrased, I think the more pedantic the consumer is, the better, because then they say, look, that might be misinterpreted as, asking this. So then they really had a look at the interview questions, and we did a dry run. I did a dry run with them of, okay, pretend that, you haven't seen the questions. We'll have a practice run and see how the interview goes. And this is because the second part of my thesis was an interview study. So it's a qualitative study. I had to interview participants. And that's why we designed the interview questions and we did the practice. And the last one was interpreting research findings. And as I've said, this is important because the consumers had a look at the quotes from the interview, and they provided, I know exactly what this person is saying. This is what they mean. So in terms of interpreting and making it richer, I think that's what's very important at that stage of interpretation of the research findings once we've done the analysis. And yeah, so those are my experience. I suppose to wrap it up, what is needed when involving consumers is to make sure that you have a genuine connection. It's important to have an authentic shared agenda. Normally consumers are very passionate about what they do, about what they've experienced. And as researchers, you should be able to have that genuine connection so that they feel the value of being involved in your research. And for you also then have to acknowledge their time, because it's most of the time voluntary, and their contribution to your research. So that's all for me, and thank you very much for listening. And I'm open for some questions that you might have.
Thanks. Thank you, Dion, for that insightful presentation. I think, if I can echo a couple of things, and for, this presentation, which will go out to all of our groups across the country, it's really important to know that consumers or patients are a very important part of the process. At the end of the day, patients, consumers are the ones being treated, but there's this mentality that the patients really don't have much of a say. They just get told what to do on the journey and they just plod along. And ironically, it's actually not the case, because without the
Actually, the
patient,
opposite.
it's actually opposite. Without the patient, the cardiologist or the GP can't bill, and they don't make an income. Without the patients, the pharmaceutical companies won't be having a product that could pass on to them and to for their target therapeutic benefit. So, all the things that we do is around the patient. But I think you are
Absolutely.
right. We sometimes forget to actually really include them in along the journey, more like direct them, say, oh, this is good for you, you should do this, but really don't ask them, well, how would you do it, if and help us, tailor a research project to really benefit you in terms of, instead of us trying to think what would benefit you, because we're not in your situation. So I think it's very key, and something I stress across all of our patients and our consumers across our network is that they shouldn't be shy to ask questions, and they should get involved in perhaps research, because their input and their experience can help you, me, others in research,
Absolutely.
really put together some really interesting projects that will have really significant benefits. So I guess just a question on your presentation: how to get involved, how to be a consumer rep, from your perspective for patients, for our consumers.
So that's a very good question. So there are organizations such as, and I should have probably put it in the slide, but there are consumer organizations such as the Consumer New South Wales, for instance. So if you get in touch with Consumer New South Wales and express your interest, they do have training sessions for consumers on the expectation for consumers, and just a bit of background on what being a health consumer research entail, but also I suppose with Heart Support Australia as well. If you get in touch, and there are organizations with consumer group representatives. So Solve CHD has a consumer group, for instance. So there are avenues to kind of vote if you want to volunteer.
Yeah, and I guess on that note as well, what about, say, from a clinician perspective? So if you've got, ensuring kind of the engagement is authentic or genuine.
So I think engaging consumers early is the key. You don't approach a consumer when things are already rolling, because at that point they're not going to have an input on some of the steps. So I think even before, if you have an idea in mind, I mean, for researchers or for clinicians, it would be good to run it past a consumer group, get their interest, and then get them on board, keep them interested, keep them engaged, keep them involved, and nurture that relationship. So then it doesn't become a tokenistic step in the process of, have you asked the consumer? Yes. And then on to the next research phase. So I think it would be good to have an establishment of the relationship at the start, and continuing it through.
That makes sense to me. So look, thank you for that. I will allow for questions with those attendees that we have on. They're welcome to unmute themselves and or shoot through a chat message if they like. Totally up to them. I guess just if there are no questions, and I guess it is an interesting topic and something for a lot of people to learn. I guess one of the questions I do have, Dion, because this is something that's been quite new to the role, coming in as a CEO of Heart Support Australia. I've always had a clinical research background, as you know, and so now thinking from a consumer mindset is very different and very unique. In terms of moving forward, where do you see the role of consumers in research, in the sense that do you believe that there is still significant roadblocks in the way to get genuine consumer engagement in research projects, or do you think that this is something that is actually pretty well on its path to be quite good? I've seen good examples, I've seen bad examples. I think we all kind of know. So, where do you kind of see this pathway?
Yeah, very interesting question. As what you said, I've seen very good, genuine co-design, co-production,
Mm,
kind of collaboration
yeah.
with consumers. But I think if you look at, I think consumers being mandated, for instance, in grants, that pushes people to go through the tokenistic route of, because it's mandated, we don't have a choice but just get someone on board uh, and tick that box, if you like.
Mm,
But sometimes it can start there, and then the relationship gets nurtured and they produce something beautiful in the end. So I don't know. I think we are it's definitely gaining attention. There is a highlight of involving consumers, but the authenticity of it and whether it's genuine is another question.
it is. And I guess this gives me to my last question before everyone can head off, and that is, what about the contemporary mindset of the consumer? So, for instance, someone has someone had a stent 20 years ago. Now, technology 20 years ago was far different to what it was now.
Yeah.
The treatment time, the interventional time, the recovery, all these type of things. And so, how important is it, I'm thinking from my mindset, to actually have a consumer that is actually quite contemporary? Not meaning that the ones 10, 15, 20 years ago are not included, but I mean, there would have to be some type of a mindset to think, well, actually, things are very much different from back then. You know where I'm going with this. So
Yeah.
where's how recent do they have to have been through the cycle in terms of their cardiac journey?
That I really like that question, and it's something. The reason I like it is because it's something that I haven't really thought about. But you're right. Like, I mean, in my case, for instance, if someone says, "Oh, I've done my cardiac rehab, I don't know, 5 years ago," that model would probably the current model probably looks nothing like the 5 years ago model, because there
Mm,
are trackers, there are different things involved. Um, I think I think there should be there should have an element of recency in terms of involvement. If you have had an event, and particularly if it was an intervention, for instance, um, there should be a bit of recency. But then again, people could argue that the experience would be the same because they've gone through the same traumatic experience from 5 years
mm.
ago. It can't be too different from what a person would go through, in more recent times. So yeah,
It's an interesting thing to think about,
it
right? I
is.
mean,
It's
we
very
talk about
interesting.
all these things to try and get a gender balance, we try and get age balance, and all these type of things. Perhaps recency of those maybe having procedures 10, 15 years ago to more recent should also be a factor as well. You know,
Hmm. Yeah, exactly.
so
Exactly.
definitely some food for thought. But look, on behalf of Heart Support Australia, thank you so much.
Pleasure.
We're so glad to have had you a part of this tonight, and something that will be seen across our 22, 23 locations across the country. and along with any others who go through our website and socials. So thank you again for joining us. It was a very
Thank you for
insightful,
having me.
it was a very insightful talk around consumer engagement and consumer research, was quite important topic. So all the very best, and for those, please stay tuned. We do have another Heart Support Connect planned for September of this year, and the speaker will shortly be announced, and I think you will find it's a very enjoyable talk. So thank you again and have a nice night.
Thank you. Thanks, Christian. Bye-bye.
Take care. Bye.